Dental implants offer a perfect replacement method for missing teeth. After your dental implant procedure within the first 2 to 3 days, the site or sites will require some attention and care. Avoid eating anything until the anesthetic wears off, as you might accidentally bite your lips, tongue, or inside of your cheeks. Avoid any chewing on the surgical side of the mouth. After the freezing wears off, eat normally. Soft foods are best, but avoid sticky, hard, spicy, and acidic foods. A liquid diet or meal replacement drink may be used for the first 1 or 2 meals. Do not consume carbonated beverages or drink anything through a straw. Take your non-aspirin pain medications as directed. If an antibiotic has been prescribed, take it as instructed. To reduce swelling, apply a cold compress to the area, alternating every 20 minutes on and off. Avoid any strenuous physical activity to minimize bleeding. Minor bleeding may occur. If bleeding persists, apply continuous light pressure for 30 minutes with a moistened gauze or tea bag. To maintain adequate oral hygiene, gently rinse your mouth 2 to 3 times per day with either a mouth rinse or warm salt water. Gentle toothbrushing of teeth in the area is encouraged. Do not be concerned if there is mild bleeding from the site for the first few days. Remember to get plenty of rest. If you have any questions or concerns, or in the case of severe pain sensitivity, excessive bleeding, or fever, please contact your dentist immediately.